Hi, my name is Valentina Boro, and for my presentation, I will be speaking on the paper How to Improve the Robustness of Closed Source Models or Natural Language Inference. The direction I would like to take this presentation is towards the application of this paper in domain-specific areas, in this case, healthcare systems. So I'd like to quickly share my slides and continue from there. Okay, thank you. Now, technology is a tool, in this case AI, to extend human capabilities and is not just a substitute for the work that humans do. I once listened to a conversation on Stanford Online about the current state of AI in healthcare. Now, this talk explored fair and equitable outputs from AI and also the challenges that the healthcare industry faces with AI adoption, such as medical hallucinations, and ways to solve these challenges. Now, for a high stakes area such as healthcare, accuracy and reliability of models is of utmost importance. The decision of a model may mean life or death to a patient. And there is increase in availability of multimodal data as well as computing power and data security. And these are converging to transform healthcare delivery through AI augmented systems. However, however, there are a number of factors that pose a challenge to this. For example, there are there's the high compute cost to train LLMs, and for existing LLMs, as highlighted in the paper, a lack of access to model internals or any modification of the training process. Now, this has therefore led to a focus on data-centric improvements of models. The experiment in the paper shows the feasibility of using a small amount of data to achieve its objective of model robustness. And this is a strong indicator to me of why I believe it can be explored in the healthcare system because there is a limited access to expert annotated data. Now, we can further explore this paper in a medical environment scenario. The reason being that medical diagnosis and treatment follow a logical inference pattern that aligns well with natural language inference processes of premise, hypothesis, and inference. The results from from the paper shows that closed source LLMs are substantially more robust than encoder models, especially on challenging out of distribution data, and for less challenging out of distribution data. Replacing some of these training examples with synthetic data, that is LLM generated data, is the best strategy and can lead to substantial improvements. Now, further practical application of this paper in medical scenarios include validating diagnostic reasoning. Yeah, basically exploring the relationship between symptoms and diagnosis, treatment appropriateness, validating therapy recommendations, and clinical guidelines compliance checking. Using a data-centric method that was carried out by this experiment to improve robustness of LLMs with regards to medical data will help to bypass excessive compute costs, as was mentioned earlier. Also, in complex clinical cases, using uncertain sampling can aid LLMs to understand challenging diagnostic examples, and in routine scenarios, augmenting with synthetic medical data. Now, the use of generated synthetic medical data will effectively reduce patient exposure and improve privacy concerns. So, at the end of the day, real world impact can be made by exploring this path. And AI may become a tool that extends the capabilities of healthcare providers in patient care. Thank you.